My name is Dr. Amy Hughes, and I'm the course mentor for Intro to Special Ed, Law, and Legal Issues. The following presentation will cover the topic of cross-categorical learning disabilities. This presentation will review the following areas: the causes of mild disabilities, what cross-categorical disabilities are, an overview of each of the disabilities, and how we can make the connection with IDEA law. Causes of mild disabilities. There are two main areas that contribute to disabilities. The first area is organic or biological. These contributors originate within the body. Pre, post, peri, and postnatal factors include rubella, maternal use of drugs, alcohol and smoking, maternal age, anoxia, and accidents, just to name a few. Genetics deal with chromosomal and gene mutations, and they're passed down throughout members of the family, resulting in inherited disabilities. Biochemistry deals with the chemical process that occur in the body. Disabilities caused by biochemistry typically deal with imbalances in the brain. The most common disabilities deal with behavior and emotional disturbances. Maturation deals with different developmental levels of students. The disabilities within this area involve cognitive delays and the lag between normal development. The second cause of disabilities is environmental. Factors such as trauma, early injuries, and accidents can affect development and learning depending on the severity of the trauma. Nutrition or lack of can contribute to learning disabilities and behavior problems. This is most often caused by lack of nutrients that the body needs. Toxins in this instance doesn't refer to drugs and alcohol, but it refers to materials such as exposure to lead, mercury, chemical spills, and radiation. The last two come from the realm of neglect, language and sensory deprivation, and emotional and psychological factors. Lack of communication and bonding with children, abusive and fearful home lives contribute to emotional disturbances. This slide is just for reference to see how the factors come together and interact. Issues of poverty and neglect can transcend and connect the different factors. For example, the use of drugs by mom on the organic side connects with neglect and possible abuse or bad situations on the environmental side. So cross-categorical defined. What exactly are cross-categorical disabilities? These are disabilities that aren't directly mentioned in IDEA. There are four main categories. While we can't qualify students just under one of these categories, we can usually qualify them in or on an IDEA category and provide services for these four within the IEP. The four categories are ADHD, Asperger's, pervasive development disorder, nonverbal learning disorder. And the last three here all fall under the autism spectrum. The first one of breaking down the disabilities will go through the aspects of cross-categorical with ADHD. ADHD is pretty familiar to many of us. We know it's pretty much from the definition listed here. What is less known is the various types of ADHD. In order to be diagnosed, students must display at least 6 of the following symptoms. And those symptoms include fail to give close attention to details, does not seem to listen, does not follow through or finish tasks, talks excessively, visits with hands or feet, squirms in seat, runs about or climbs excessively, and there are many more that they can use to qualify. ADHD falls into the various federal categories. There's inattentive type, hyperactive impulsive type, and combined type. ADHD has been linked to chemical imbalances in the brain. It has also been linked to genetics. The frequency of coexisting diagnosis with ADHD is 25%, the most common being learning disabilities and then emotional disturbance. To determine if ADHD is present, The symptoms have to occur no later than the age of 7 years, and the symptoms have to be present for at least the past 6 months. Severity of ADHD can appear to diminish over time. Pervasive development disorder. This term is used to describe a group of neuro and biological conditions. It's most commonly associated with the autism spectrum. Characteristics of PDD include delays with social, communication, and cognitive development. There are 5 categories that fall under PDD. There's autism, Asperger's syndrome, Rett syndrome, childhood disintegrative disorder, and pervasive development disorder not otherwise specified. The most frequent found and the most known to us is autism, and it's the most recognizable and diagnosed category. The characteristics can be classified from mild to severe. Pervasive development disorder can have a large effect on students, particularly with their peers and in social situations. This image below shows the classification scheme and how it relates to the DSM, which is a psychological manual. Asperger's, also referred to here and through other professionals, is also known as highly functioning autism, and it falls under the PDD umbrella. It holds its own with its characteristics, although it is a cross-categorical disability. It is separated out from PDD. Students with Asperger's typically have normal IQs and language, but they struggle with social skills, and many have sensory issues, like having sensitivity to smell, sounds, taste, and sight. Causes of Asperger's are neuro and biological. As stated before, many characteristics overlap. The prevalence of Asperger's is higher in males than females. Many students diagnosed with Asperger's also have a high frequency of a dual diagnosis, so you may see more than one of these listed with Asperger's, even though they all technically fall under the PDD umbrella. Nonverbal learning disorder, or NLD, also falls under the PDD umbrella and deals with brain hemispheres. The name nonverbal learning is a bit confusing. When we hear nonverbal, we automatically think that speech or vocab is non-existent. However, for students diagnosed with NLD, they have very high verbal skills and are very eloquent in their speech. Issues such as reading comprehension and math are their more weaker areas. They prefer to talk about what they learn, and they learn best by discussion over hands-on completion of tasks. NLD is characterized by the following 4 areas where dysfunction can occur: motoric, lack of coordination and balance; visual, spatial, poor visual recall; social, lack of social context and interaction; and finally, sensory, which is sensitivity involving the senses, such as touch and smell. NLD can cause other disorders to manifest, so early intervention and identification are important to help prevent misdiagnosis. Misdiagnosis occurs due to anxiety, obsessive compulsive disorder, post-traumatic stress disorder, and depression, just to name a few. So if we can't qualify students with just these main 4 diagnoses, how do we get services for them? Well, many of these can be related to a category that is recognized by IDEA. As shown here, most have 2 or more options that can connect and that are available for us to qualify students with to get services. The main thing is to keep in mind that these are based on the dual diagnosis and the disabilities, and not all the connections or all the determinations are going to be the same. It all comes down to the individual child and their needs. Finally, if you have any questions, please feel free to contact me either by phone or email. I look forward to working with you. Thanks.